Well, hello everyone. This is Dr. Christopher Jackson. Thank you for visiting us. I am Dr. Christopher Jackson, PhD, DOM, Florida, and my practice is A Path to Wellness. So you're visiting a little snippet of A Path to Wellness here in beautiful downtown St. Petersburg. Wanted to talk to you today about thyroid and the functionality that's involved in thyroid and how it might affect your body. And a lot of people seem to be falling through the cracks in terms of thyroid function in this country, in the United States. It seems like we're treating a lot of people without paying attention to their signs and symptoms, or maybe even ignoring them, downright ignoring them. When somebody presents with the signs and symptoms that are related to a thyroid disorder, quite often what happens is the clinician takes a look at a sheet of paper, their lab report, looking at their blood work, and they may just be looking at one factor in that blood work, and that is TSH, known as thyroid stimulating hormone or thyrotrophin stimulating hormone. And that factor, unfortunately, is not directly related to the thyroid itself. In point of fact, that is a hormone that stimulates the thyroid. It's not a hormone or a factor that looks directly at what the thyroid itself is producing, but it's being used as a screening tool for thyroid disorders. So when a clinician looks at that lab work and sees TSH in a normal range, they're making the leap that, oh, the thyroid's fine, see ya. And if you keep coming back and complaining, oh, I still have these symptoms, I still have these signs, then they write you up for a psych visit. Have you ever had that happen? Some of you have, I bet. So a lot of people are falling through the cracks partly because the information that's looked at is not the right information. At A Path to Wellness, we look a little deeper, quite a bit deeper actually, at thyroid function. And we look at the hormones that are actually being produced by the thyroid, not just what's stimulating the thyroid. So the reasoning with TSH is that the thyroid's being stimulated more when the thyroid function is low, or the thyroid is being stimulated less when the thyroid function is higher. And that makes some sense, and sometimes it's accurate. But a large percentage of the time it's not, because the thyroid function is affected by many issues, including stress, adrenal function, sickness, illness. It's affected by other issues like hypovitaminosis D, where you may be low in vitamin D. You may not have certain minerals at the right levels to affect the breakdown of thyroid hormone. There's many issues with it. It's not just what the thyroid is producing. There's more to it. It can also be the breakdown of the thyroid hormone from T4, it's called, to T3. It can be your absorption into your tissues of T3, the active thyroid hormone. And then there are other factors involved in which thyroid hormones we're looking at and their effects on the body. For example, one that's often not talked about is calcitonin. Calcitonin downregulates the amount of calcium being pulled from your bones. So if you're getting elevated calcium levels, it may be because your body's not very sensitive to calcitonin or other thyroid hormones. It's not breaking down the thyroid hormones correctly. It may be ineffectively responding to the calcitonin. So there are many issues at various levels of depth involved in thyroid function. And looking at a simple screen of TSH, thyroid stimulating hormone or thyrotrophin stimulating hormone, is not enough. It's not enough to really know, is there a thyroid issue or not? And so this is a big part of why a lot of people are falling through the cracks. So what do you want to look for? Well, you can look for, are you low in energy? Are you constantly fatigued, tired a lot, having trouble getting through your whole day? Do you have some blood sugar regulation issues maybe? it's not just about pancreas and insulin or glucagon, which I could talk about in another video, but it's about metabolization. That's what your thyroid's all about. And drawing in the nutrients and the sugars into all of your cells. So there may be many issues affected by that. So blood sugar regulation is one. Are you constipated? Do you have elevated cholesterol? You know, in many cases, elevated cholesterol has to do with thyroid dysfunction, not just with veins and cardiovascular function. And unfortunately, a lot of people are treated for the symptoms, elevated cholesterol, and not treated for the cause, such as low thyroid function. Now, there are other causes for cholesterol issues, but that's not what we're talking about today. So, thyroid function can affect your cholesterol level, can affect your blood sugar regulation, can affect your bowel movements. I have patients actually come in to see me and I ask them, how are their bowel movements? And they say, oh, I'm fine. And I say, okay, well, how often are you having them? And they'll say, well, about every 3 days. No, you should be having 3 every day. If you're having less than 1 a day, you're definitely constipated. So, and that can relate to thyroid dysfunction. There are many, many issues. Hair loss can be one of them as well. It's kind of funny, bald guy talking to you about hair loss, but hair loss can be one of those issues. Your nails might be brittle. They might be cracking. They might be spotty. You might see white spots on your body. You might even have areas of white mixed with other areas of skin tone. And that can be an indication of vitiligo, which has been correlated to thyroid function as well. So there are many issues related to thyroid function. And any of those can be missed because the wrong values are being looked at. So pay attention to your own body. You know, if your body's telling you you're not doing well, keep looking. I have people come to me after 10, 12 different doctors they've talked to, and they've been shooed aside, told, you know, it's all in your head, things like that. And we finally get to the core of it, and they're doing better. Other issues you might have, weight loss or weight gain. Okay? Thyroid dysfunction can be on both ends of the spectrum. You can have low thyroid function, which means you tend to gain weight and have a poor metabolism. You can have high thyroid function where you tend to lose weight, have a high heart rate. You may have, your eyes may start to look like they're bulging out of your skull. It's called exophthalmos. That's because the muscles behind your eyes are tensing up and pushing your eyes outward. So you may have headaches related to that. That would be more on the hyperthyroid end of the spectrum. And we have different disorders, thyrotoxicosis, Graves' disease, others related to thyroid. There's the high thyroid end. And then we have low thyroid function or hypothyroidism. But there can be other issues like autoimmune disorders, for example. Hashimoto's is a common one. Hashimoto's was found or discovered by a Japanese fellow by the name of Hashimoto. And it is an autoimmune disorder where the functionality of your thyroid is being essentially attacked by your immune system. And so we can get to the core of why that's happening. And that can be in your diet. It can be in what you're taking or not taking as far as supplementation, nutrition, nutrients that your body may be depleted in. There's a lot of reasons these things can occur. But all of these are related to thyroid function. And what happens long term with Hashimoto's is typically thyroid is continuously attacked, or the thyroid function is attacked. Release of thyroid hormones may raise your metabolism. You may see some tachycardia or palpitations, high heart rate in other words, or palpitations, fluttering in your chest. You may feel anxiety. And these things may occur intermittently. And what's happening there is gradually, as those hormones are produced and your metabolism is increased, your thyroid function is gradually dropping. So you end up with hypothyroidism typically. Although intermittently, your thyroid may actually be high functioning or your metabolism may be high. So as you can see, there's quite a conglomerate of issues that you may see along the way with your thyroid. If you're experiencing these things, don't ignore them. Don't just be shooed off. Take charge of your health and talk to several people until you get somebody to listen. That's all I have for today. You've been tapping into A Path to Wellness. This is Dr. Christopher Jackson, PhD, DOM, Florida. And if you'd like to listen to our radio show, you can listen to podcasts on rhinoonair.com. That's RHINOONAIR.com. Podcasts of A Path to Wellness. Our office phone number is 727-329-9637, and our website is www.aptw.net for A Path to Wellness. All right, once again, nice talking to you, and we'll see you next time.